Dieses Video präsentiert Ihnen Eumedics.
Hello, my name is Marjorie Taff, and I'm a registered respiratory therapist and product specialist for South Medic. Today, I'm introducing and demonstrating how to use the OxyMask family of products. OxyMask is a revolutionary mask design capable of delivering the entire range of oxygen therapy, eliminating the need for multiple traditional oxygen therapy devices used today. The adult OxyMask delivers 24 to 90% oxygen simply by titrating the oxygen flow rate from 1 to 15 liters per minute and flush flows. OxyMask is the ideal oxygen interface for emergency first response, acute hospital care, home care, mass casualty disasters, and pandemics. Here is how OxyMask works.
At the heart of this visionary technology is an innovative pin and diffuser system designed to concentrate and redirect the flow of oxygen towards the patient's nose and mouth. Let's take a closer look at how this system works. Oxygen enters the system through a right-angled swivel at the front of the mask. The mushroom-shaped pin redirects the flow of oxygen, forming an organized pattern of vortices and a cloud of concentrated oxygen molecules. The triangular directional diffuser refines the shape of the oxygen vortices and directs the flow towards the patient's nose and mouth. During the patient's inhalation, oxygen flow is mixed with room air drawn in through mask openings. Respiratory mechanics and breathing patterns determine how room air combines with the delivered oxygen. The concentration of oxygen received during the breath is a function of the oxygen flow compared to the patient's inspiratory flow and tidal volume. During exhalation, the mask openings allow expired carbon dioxide to escape. As a result, the OxyMask is a highly efficient open mask system that eliminates the need for a closed design, valves, and reservoirs. With its broad range of FiO2 concentrations from 24 to 90% at flows ranging from 1 to 15 plus liters per minute to flush, the OxyMask's open technology replaces traditional oxygen interfaces. Historically, clinicians have needed up to 4 different oxygen devices to achieve the same range, but not anymore. The large openings in the OxyMask provide several intrinsic benefits to an oxygen therapy device. These openings reduce the risks of rebreathing carbon dioxide and aspiration of emesis. They also allow for suctioning and comfortable nasogastric tube placement while maintaining continuous oxygen therapy. The benefits to the patient include reduced claustrophobic feelings, increased communication, and improved accessibility for oral and nasal care, all of which improve patient comfort and compliance with their oxygen therapy. Clinician benefits include simplified workflows by replacing time-consuming and error-prone device exchanges with a single, easy-to-adjust mask. With its broad oxygen delivery range, OxyMask allows greater operational efficiencies. Hospitals have less to purchase, less to stock, and less inventory to manage. OxyMask reduces medical waste and disposal costs and could facilitate earlier patient discharge, as patients may not need to be transitioned to a nasal cannula before they leave the hospital. Finally, OxyMask is not made with natural rubber latex or phthalates such as DEHP. OxyMask does offer select product codes that are also non-PVC.
Now let's look at the OxyMask family of products. This is a standard OxyMask. This mask fits the average size face, approximately 80% of the patient population. Here we have the OxyMask Plus. These masks are 25% larger than the standard mask and are used for patients with a larger face and/or a beard. The OxyMask Plus may also be used on the patient whose mouth remains wide open while breathing. For pediatric patients, this is the OxyMask Kit. These masks are for children 3 to 10 years old or within the weight range of 33 to 70 pounds, 15 to 32 kilograms. This mask may also be used for an adult patient with a smaller face. And this is the OxyMask Tyke. These masks are for children 6 months to 3 years old, or within the weight range of 16 to 33 pounds, 7 to 15 kilograms. Unlike the OxyMask, OxyMask Plus, and OxyMask Kid, the OxyMask Tyke delivers 22 to 65% oxygen while using flow rates from 0.25 to 5+ liters per minute. When using the OxyMask, proper positioning and fit is important. An appropriately sized OxyMask will fit below the eyes and cup the chin. Remove the OxyMask from the packaging, recycle or discard the insert inside the mask. Gently rotate the swivel elbow to release and achieve the desired tube position. Attach the universal connector at the end of the mask tubing to an oxygen source. Place the mask on the patient's face with a swivel and diffuser pin assembly centered below the nose and above the upper lip. Remember, an appropriately sized OxyMask will fit below the eyes and cup the chin. Position the elastic strap below the patient's ear or at the crown of the head, maintaining comfortable tension. Avoid pressure on the ears. Adjust the oxygen flow from 1 to 15 liters per minute or to flush flows. If using the OxyMask Type, adjust the flow from 0.25 to 5+ liters per minute to achieve the prescribed patient oxygen saturation. The tubing on the mask can be adjusted at the swivel to relieve twisting or torque. Allow the patient to stabilize and assess. If necessary, adjust the oxygen flow rate to achieve or maintain the prescribed oxygen saturation. As with all patients receiving oxygen therapy, please contact the physician or respiratory therapist for any acute patient change, or as per your organizational policy. A yellow endotracheal tube adapter is available upon request and can be easily attached to the OxyMask. This adapter attaches directly to the connector of the endotracheal tube or laryngeal mask, providing oxygen to the spontaneously breathing intubated patient. Once the patient is extubated, remove the yellow adapter and place the OxyMask directly on the patient's face to deliver oxygen therapy in the usual manner. An FiO2 flowchart is attached to all OxyMask product tubing. Flow rates with a corresponding FiO2 range is indicated. This provides a quick, easily accessible reference guide for the physician. OxyMask is the one mask that can be used and transitioned from pre-hospital to acute care, palliative care to home care. OxyMask is the one mask for patient safety, patient comfort, and oxygen therapy compliance. One mask, OxyMask. To complete a short online test and for more product information, please visit us at thebetteroxygenmask.com.
Dieses Video präsentierte Ihnen Eumedics.